Hello there, and welcome to the podcast where we are recording at our new hospital.
I know, it's pretty exciting.
I'm Dr. Vernaleken.
And I'm Lindsay Renzullo. We just are coming back from our summer break, so we're glad to finally be back because we kind of missed you guys over the summer.
Yeah. Did you have a good summer?
I did have a good summer. It went by really, really fast, but it was fun. Yeah. And we moved in the summer.
Yeah.
This was a huge move for Bulger to kind of move the entire facility to this brand new building, which is beautiful.
It went well, though.
Yeah. It went really, really smoothly. So if you haven't been by, you got to come by because it's actually great here.
Come and visit us.
Yeah. So we're happy to have you back because we have a few summer topics that we kind of wanted to touch on. So things that have happened over the summer while we were away.
We've been thinking about you because all summer we've been jotting down, we need to talk about this on the podcast. When's the next one? September.
Yeah.
It's a long time.
Yeah. So here we are.
Yeah.
So the first topic we thought we would sort of touch base on. Well, do you want to talk about the EEE?
Let's talk about EEE.
Because it's sort of a fast topic, but it's really right in the news right now.
And we're not referring to EEE, World War II battle, the Battle of Tripoli. No, we're not talking about that. We're talking about EEE, 3 E's, EEE, Eastern Equine Encephalitis.
Mm-hmm. So it is a disease that happens in horses. So Krista and I, Dr. Vernaleken and I, we don't treat horses, but we did learn about it in vet school a long, long time ago.
Are you referring at all right now to knowledge that you remember from vet school? Or are you referring to what you just looked up?
Just looked up.
Uh-huh.
Yeah. So, I do remember it obviously in vet school. There's a couple of equine encephalitis, sort of that family or that group that we learned about in school. And the reason being is that they're really, really problematic in horses. And so these viruses, there's a grouping of 4 of them. There's the Eastern Equine Encephalitis. There is the West Nile virus. There is a Venezuelan one, which is a reportable sort of foreign disease. And then there is Western Equine Encephalitis. So there's these 4 encephalitises that sort of hit our equine friends, and they're awful. The Eastern Equine Encephalitis actually has an extremely high mortality rate in horses that get this disease. It's going up on 90% of mortality rate on some of these patients that acquire it. So it's an awful disease for horses. But the good news for horses and horse owners is that there are vaccines to help protect against them, or to help protect against these diseases. But the problem being is that there's really no vaccine for humans that's out there commercially.
So it's a viral disease. It's passed by mosquitoes. Mm-hmm. So really areas of the country that don't have a large horse population are seem to be a little less affected. But it actually occurs primarily, it starts in birds. It comes from birds and transmits over to horses and humans and other mammals in theory, but in practice, it's really just horses, humans.
And this environment, on the East Coast, seems to sort of harbor the most. So even though we do have horses in certain areas here, it's the swamp-like and the weather.
We're making Massachusetts sound great, but we do have a lot of mosquitoes.
Yeah, and Massachusetts, actually, we do have a map that we're going to upload into our Facebook feed at some point when we figure this out. But the map basically shows that Massachusetts is the second hottest state that has the most cases. So currently, I think there's 10 cases or something in Massachusetts. Florida being the other big one. But if you can see it, it's really sort of zoned in mainly on that eastern seaboard. So
even places that have a large horse population don't necessarily have it because they don't have the mosquito population.
So, it is transmitted, like Dr. Vernaleken said, it is transmitted by mosquitoes. And so what happens if people get it? What do they look like? Well, what ends up happening is because it's an encephalitis, we do start worrying about sort of swelling within the brain, right?
Yeah.
So after you've been bitten by a mosquito, anywhere from 2 to 10 days after a mosquito with this virus bites you, you'll start developing some signs. And based on the clinical signs that you have, the doctors through the ER or through the hospital will be able to start filling out if we're going to be testing for, encephalitis or EEE. It's bad though, because there is a mortality rate to it. What was it, 1 in 3?
Yep, 33% of humans die of it. And the others, it's not the kind of thing that you always or even necessarily recover fully from. So they often have lifelong neurologic issues.
Yeah. And so far this season, which it's most common in the fall season, there's been already 1 reported death in Massachusetts. Yeah. And there's been, I think, 5 other ones in Massachusetts alone, or maybe even more than that.
But don't think that this is an epidemic. So annually, the CDC reports that there are usually average 7 total cases a year. Mm-hmm. So we're at 5. It's not by any stretch an epidemic. Some years
Right.
there's more, some years there's less, but that's out of the entire, local population.
Right. So what they'll say is, I'm sure you've probably heard it on the news, is just to be cognizant about times where mosquitoes are going to be out. And if you live in one of these critical areas, meaning they actually have a confirmed case of EEE, or they've gotten a positive test on a mosquito that has EEE, is to be really, really careful wearing like long sleeve clothing. DEET is very important. Nice bug spray. Try to limit how often you are outside during those hours. So dawn and dusk, in the middle of the night, things like that, where mosquitoes are really out and they're feeding in those particular times.
Yeah, I was joking around before that, a lot of people are like anti-DEET, but you will never find someone so pro-DEET as when a more serious disease could affect your child. You'll spray the DEET right on.
It's true. You do not want to get EEE.
And then this is, of course, an animal podcast. So dogs, we have been getting the question, do people have to be concerned about dogs? There's a few cases reported in puppies. And when I say a few, I mean a handful of cases. So this is not something that adult dogs are concerned about, or really puppies. You should be concerned about yourself and protect yourself.
Yeah.
But it's not a disease that we consider dogs are at risk for. But birds, so chickens, we have a lot of chicken coops in the area.
Yeah.
So we should try to keep those chickens not exposed to their mosquitoes. And that's ideally trying to bring the chickens in from their outdoor rompings before dusk, so they're not as exposed to the mosquitoes. And then I believe that there is a vaccine for some bird species, but we would have to check with our specialist. That was a bummer because we were supposed to.
Sorry, guys.
Because we don't see chickens, but we do have a veterinarian here that does, and you are welcome to give a call to check that out.
Yeah. So that's EEE. So it is obviously something of concern, a little bit more geared towards the human level of concern, because we actually don't even have a lot of clients that have horses. Well, maybe they do.
I wouldn't know because I won't see them.
Yeah, we don't see them. But it is something that is of concern more for people. So just to be cognizant and aware of it.
Hopefully we'll get a frost soon.
Yes, get those
mosquitoes
out.
One would never hope for a frost.
Those mosquitoes are just awful. They're awful. So that's sort of what's going on right now. That's sort of big in the news headlines. And another thing that happened sort of over the summer months, there was a lot of discussion and a lot of talk with a lot of our clients about this, was the FDA came out with this big statement at the end of June. And the FDA, or the Food and Drug Administration, really doesn't honestly get too much into veterinary food diets that often, but they basically issued this warning that was really concerning that said, you know what, there are some links to grain-free diets causing a cardiomyopathy in patients that don't normally get certain cardiomyopathies or certain heart problems. And this sort of floored a lot of pet owners, because for a while, pet owners were sort of going towards grain-free diets, thinking this was like really the best food that they could feed their dog. Sometimes it was the more expensive food. They were like boutique brand diets that, sounded like they were like really, great foods, and not that they necessarily were, but they sort of were depriving the diets of these grains. And because of that, they were actually having some issues or some problems with heart issues that weren't normally reported before.
Yeah. So to give you an idea of the scale, it's a few hundred cases a year recently. Remember that grain-free diets have really just become very popular in the last few years, but a few cases out of all the canine population have had this issue. So it is definitely something that we have our eye on and want to know more, but I don't think we have all the information out yet. So the big thing that we know is it seems to be linked to grain-free diets whose primary carbohydrate source is a legume or something not cereal based. So like a cereal grain is the wheat, rice, even potatoes are considered cereal grains in the veterinary nutritionist literature. So those foods, and why those specific dogs, we don't know. There's probably some genetic linkage as well. So the biggest thing that I have, and I could go on a rant about this.
Oh yeah.
So we see people all the time that come in. We've ranted about this before on this podcast. You come in, you say, oh, my dog's on the best food. It's this grain-free food from X brand. And I never would argue with people before. I just went, okay, that sounds great. What makes that food the best food? If you really ask yourself, what makes that food the best food? Why? Because the bag's pretty? because you paid a lot of money for it, because the pet store said it was the best food, because you read something that said on some website that said grains are bad. So you really have to think about that. I've fallen prey to that too. I pick up all kinds of beautiful bags of like weird pea snacks, the peas, smashed peas.
For yourself?
For myself.
Oh, yes. Yeah, that is
I
true.
fall prey to all kinds of marketing. But in the end, that's what this was. This was marketing. So there is no justification at all for feeding your pet a grain-free food. There is no study you will find, nothing that will say that grains are bad. It's a little bit of a proxy for people thinking that these pets are carnivores, so carbohydrates must be bad. Please don't deceive yourself into thinking that a grain-free food has no carbohydrates. They have carbs, and they'll be in the form of these lentils. Yeah. So it's all this kind of came to a head. Were any vets surprised that there were issues with grain-free?
That's the thing. Like, no vets, I don't feel like any of the team here or any of the vets that I know outside were like, wow, I can't believe that grain-free diets actually have an issue like that has come about. Because a lot of the brands too that market these grain-free diets, and again, this isn't to down any particular brand, or to try to out any brand in particular. Nope. But a lot of those brands, they don't have veterinarians on staff. So a lot of the mainstream foods that honestly get a lot of, flack on the internet, they get, sort of bombarded by a lot of people that these certain companies don't really care about the well-being, or the food isn't that great, or they have these byproducts in it, and that makes these foods awful. A lot of those mainstream foods, none of them are listed. None of them are labeled because they don't have grain-free diets, because they have veterinarians on staff. They have nutritionists on staff. They have well-balanced, well-formulated diets that have been working for years.
And they've done food trials.
Right. So a lot of the boutique brand foods, I don't know if you guys know this, or a lot of the specialty companies, they don't necessarily have to do food trials before they release their foods onto the market. And so, you can get just a really good marketing team to make the food look really amazing, and they can price it a little bit higher. And maybe it did cost them extra money to make that food. It very well could have.
But I will say, it's like the food trial thing comes up frequently. Food trials are not the end-all be-all of everything. They're not perfect. But it still is. You fed the food to the animals and tested them over a course of 6 months, made sure they didn't lose weight, body condition, and made sure their blood work appeared normal. Now, you make a recipe. I could just come up with a recipe in the kitchen, like some for my family. I'm probably going to taste it before I feed it to them. I'm going to adjust it. I'm going to add. And this is the thing that when you're buying a food that didn't have a food trial, that is legitimately what they're doing. They're just creating a recipe that meets the requirements. It checks the boxes, but they're not necessarily trying it. And unfortunately, this is kind of the result of what we get. We have years of foods being fed to animals, and some of them not doing well. Would the food trial have caught that? Maybe not. Yeah. But at least they would have that justification.
And as of now, the numbers aren't atrocious. No. For the grand scheme of how big of a population we're talking about that are being fed grain-free diets. But I do wonder if the numbers are going to start increasing exponentially, depending on people now being aware of it. If their pet has a heart murmur, they might be more inclined to now going and getting an echocardiogram because their dog has been fed a grain-free diet for years. And now all of a sudden they realize, holy cow, my dog that is not a classic breed for certain cardiomyopathies is developing these things. Could this be linked to the grain-free diet? So it's just something to be really aware of, and it's something to definitely talk to your vet about, because, as far as foods go, your vet is probably going to have in their back pocket a bunch of foods that they like to recommend. I know I do.
Actually, physically in their back pocket?
In their back pocket.
I don't have food
in their virtual back pocket.
They will have a recommendation for you.
They do. Yeah. And so a lot of them, and as far as the brands that they recommend, I can't speak obviously for every veterinarian, but I feel like the vast majority will sort of pick a lot of the top brands that, again, have nutritionists on staff. They're not necessarily grain-free.
So the thing to be aware of, though, is that this is not something that every pet that's on a grain-free diet needs to switch immediately. Basically, when I'm recommending a food, an owner's coming in and they don't know what to feed their new puppy or their new dog, I definitely don't recommend grain-free as your first choice. If a pet is on a grain-free food and has been doing really well on it for years and doesn't have any concerns, the owner likes it, the pet likes it, I don't think there's necessarily a need to make a radical switch. or even a switch at all if they're comfortable with it. Because it's still, again, there's probably some genetic relationship to this. Not every dog is going to develop an issue. I also think you have to be careful with the FDA's, little thing that they issued. They issued this thing that stated specific brands, and that's valuable, I guess, a little bit. But every one of those companies probably makes a variety of foods with a variety of ingredients. So just because a food was listed on that FDA news report doesn't mean that you should avoid everything in that line. It might mean that you should switch over to one of their foods that perhaps has potatoes or rice if they have that. Some of those companies may not. They're smaller companies. They may just stick straight forward with the legumes and all of that. But you don't have to make any radical switches, and definitely talk to your veterinarian first. Yeah,
it's definitely a hot topic. We've talked about food a few episodes, and we've actually done our kitchen
episode. They're probably
episode.
Real sick of it.
I know. The kitchen episode was one of my favorite while we were cooking in the kitchen in the old Bulger. But food is definitely something that's on people's minds, and it's sort of nice because people are more cognizant of what they're putting in their own bodies, so they want to be able to do the same for their dogs and cats. They want to give them appropriate nutrition, and they want to give them high quality food. But as of now, there's really no medical reason to give your dog or cat a grain-free diet.
Correct.
So, all right. That's good.
So then our other topic, we were going to kind of highlight a case of interest or a group of cases. So we've been shocked that recently we've had, I would almost call it an epidemic, not really, of oral abscesses. So oral pharyngeal abscesses. So these are dogs coming in with giant swellings in some part of the mouth, throat, or neck.
Yep.
So we had this really a few very significant cases.
Yes.
We're not going to necessarily name specific details about the cases, but they tend to be labs, the sort of bigger breed dogs that are a little goofy, spend some time outside, and are usually often stick chewers.
They love the sticks.
Love their sticks. So you had seen that one case. Tell us about that.
So this again was a dog, and again, not to get into specific details, but had come in for acute respiratory distress because of the amount of swelling that was happening in the airway. So had a stick or other sort of a abscess, something had gone back and created an infection in the back of the throat, and it got infected because obviously the mouth and the oral area is a place that's sort of got a lot of bacteria in it. And all of that acute swelling basically started closing up the airway. And so it was a really acute emergent situation where we had to place an endotracheal tube, which means a tube from the outside down in through the trachea, kind of avoiding all of the swelling and all of that tissue, while we kept the patient anesthetized in order to give it medication to decrease the swelling and address the actual infection. They can be really scary cases. I mean, we get dogs that will be out there, and again, sticks just tend to be the most common reason why.
Well, we think though, we almost never find the stick,
right?
The offending stick.
But sometimes we've actually had the ones where they've actually we've seen the stick impaled in here. And I remember as a kid, I used to play with sticks with my dog all the time, and I don't do that anymore. I used to find a stick in the park and just chuck it and throw it, and my dog would throw it around and play with it. But that's exactly how these guys can get injured, or how they can get an infection back there. So the really awesome thing about the new Bulger is we have some advanced imaging that makes looking at these areas a little bit easier to do and give us a better view of what might be going on in the oral region.
This was one of the first cases we ran the CT on. We were so excited. I was actually in the treatment area, and they were seeing this case, and I was like, you can do a CT on that. And everyone was like, oh yeah, remember that. We can do that. The owner was willing to do it. We identified the issue, could not find the actual stick. The whole reason to do the CT is to see the extent of it. So basically to plan your approach for how you're going to treat this. Am I going to stab it? Do I have to go in surgically with a board certified surgeon because the thing is down here? And then is there a stick? Like, is there something I have to get out?
Yeah.
So most of these cases, again, we don't find the actual stick, although if you did, you would need to get it out.
Yeah.
And they're responsive to antibiotics, but only after you lance them. They have to usually be opened up. They often do develop significant swelling afterwards. That was what we found with a few of those cases, is that we needed to do other treatments to keep the swelling down while that resolved. I most commonly see them kind of like in this area. I had one last weekend that they don't affect the breathing actually, because they kind of hang down here, but they're these big, just nasty things. I'm sorry, your audio people.
Oh,
right. She's trying to tell me that I'm not. So they occur in the bottom of in between the jaw, like right where your neck kind of meets your jaw.
Yeah. There you go.
And so it looks like the dog like swallowed a tennis ball right underneath the tongue, basically.
Yeah.
So those, sometimes they'll be up behind the eye. Sometimes they'll be in the back of the throat, like that other dog. That other dog that was having trouble breathing, it was actually pushing the trachea all the way to the side and like squashing the trachea. Yeah,
it was pretty intense. The dog actually did fantastic, did well, went home. It was a very positive outcome.
It did take some time.
It did take some time, though. It was really a serious case. And I mean, they all can be because there's a lot of bacteria in the mouth, and because, if you get enough swelling, you can close off airways. You can get the pet to get even more distressed. If they have a trouble breathing anywhere, if it's a little bit harder for them, they start panting more. They get a little bit nervous. They get a little bit anxious, and that just sort of contributes and makes the swelling and makes everything a little bit worse. So, they're super cool cases in the sense that, you have something that's really, really sick and you can make it better. But they're really, really scary cases for the owner and for the pet alike. So.
Yeah. And that's, I get the question a lot from people. Should my dog play with sticks? And the thing is, no, they shouldn't. But you also have to be reasonable in terms of your yard. Like at the end of the winter, here in Massachusetts at least, we've had all these windstorms and snowstorms, and the yard is littered with sticks everywhere. So yeah, my dog's probably going to go out and chomp on some sticks, but what I'm not going to do is like throw the stick like you did with your childhood dog.
Don't do it.
Encourage them to do that. And like I see all the time these YouTube videos. My kids are super into YouTube with a little dog trying to pick up a giant stick, and I am just screaming, no. It's cute, but like that's the dog that falls down and impales itself, and the stick goes through their throat. And some of those dogs we've had them die.
Yeah, it's serious.
So, because there's a lot of really important structures there in the neck. So I just would not encourage that behavior, or try to redirect them to something that would be more safe to play with.
And then as a follow-up too, if by any chance your pet gets impaled by a stick, either in their chest, their leg, anywhere, we just recommend that you don't pull it out right there on scene. And the same goes with people too. I mean, if you get
anything impaled.
Yes, anything
not
impaled.
Just a stick.
It's true. Anything. Because what ends up happening is it almost acts like a plug. So if it went in and if it possibly hit any vital structures, sometimes it can actually act like a plug. And the minute that you take that out, you can deal with some significant hemorrhage. Yeah. Actually, one of my neighbors, he had this cute little plastic bag, and he had stuck a pencil through it that was filled with water and that wasn't leaking. And I said,
like a science experiment?
Yeah. And I said, oh, this is a very cool experiment. I said, look at that. There's no water leaking. The pencil is through the bag of water. I said, but if you pull that pencil out, you're going to have two big holes from where you've stuck your pencil in, and then it's going to leak out. So that's the same concept of if you have something that's impaled, you don't want to pull it out.
By this interaction with your neighbor.
Oh, he's this cute little kid. He's a little kid. It's not an adult.
Okay.
Oh, no. Yes, that would be a little bit more awkward.
Right.
Yeah.
It seems weird. Okay. So he was a child.
He's a kid.
She was teaching him a little science.
Yeah, that's really cool. Yeah. He came over excited about it because he thought it was interesting. So I used it as a teaching moment. So it was cool.
Very nice.
Yeah.
On that note.
Did we get any questions for any of our online viewers, Lauren?
No questions. We did have Dennis say good morning.
Oh, good morning, Dennis.
But no questions yet.
Oh,
sounds good.
Well, then that probably wraps it up today.
Yeah, we're really excited to be back. We're looking forward to a really fun season. If you guys have any questions or have any comments, feel free to go onto Facebook and make sure that you post them. We love getting any sort of feedback from our viewers.
And of course, if you have any topic ideas, any burning questions that you have, go ahead and post those, and we'll keep a list for future episodes.
And if you want, you can always listen to us. We have our audio recorded, which is why we did our descriptors here. We have our audio recorded on our Google Play and iTunes. So you guys can subscribe and listen to us on the move.
Yeah.
And thank you so much for our sponsor, Ethos Veterinary Health. We appreciate it, and we look forward to seeing you again.